Hi, I'm Dr. Michael Pulcino, and I'm a board-certified obstetrician and gynecologist. And today I'm going to have a guest speaker on our webpage. This is my son, Michael, and of course I'm very proud of him. He is a board-certified colon rectal surgical oncologist. So he's going to speak to you today about colonoscopies and screening for colon cancer. Thank you.
Hello, my name is Michael Pulcino, MD. I'm a colorectal surgical oncologist. Today, I'm going to speak about colorectal cancer and the indications for colonoscopy. According to the most recent National Cancer Center Network guidelines, there were approximately 100,000 new cases of colon cancer diagnosed in 2013. Additionally, there were 40,000 new cases of rectal cancer diagnosed in 2013. Prior to the advent and widespread use of colonoscopy, colorectal cancer was diagnosed at a much later stage. With the widespread use of colonoscopy, colorectal cancer is being diagnosed and treated at a much earlier stage. Prior to colonoscopy, patients would often present with symptoms. These would include weight loss, increased satiety, change in bowel habits, which can include a change in the caliber of the stool, also bloody bowel movements. This would often be an indication of a later stage colorectal cancer. With colonoscopy, we are now diagnosing asymptomatic colorectal cancer. By diagnosing early stage colorectal cancer, we are able to oftentimes treat these patients in a minimally invasive fashion. We can perform either laparoscopic or robotic surgery. Oftentimes this is associated with improved overall survival. Additionally, it is often associated with a decreased hospital stay. Now, I'd like to review the indications for colonoscopy. In the general population, it is recommended that patients receive their first colonoscopy at age 50. However, if the patient reports symptoms such as a change in bowel habits or bloody bowel movements, it is recommended the patient has a colonoscopy. However, it's important that if a patient has a strong family history of colorectal cancer, the patient should have their first colonoscopy 10 years prior to the diagnosis of the family member with colorectal cancer. For example, if a patient has a sister who developed colorectal cancer at age 48, the patient should have their first colonoscopy at age 38. The reason we recommend 10 years prior to the age of diagnosis is that it takes approximately 10 years for a polyp to develop into a cancer. In summary, in the general population, it is recommended that patients undergo their first colonoscopy at age 50. If a patient has a strong family history of colorectal cancer, it is recommended that the patient undergo their first colonoscopy 10 years prior to the diagnosis of their family member with colorectal cancer. Thank you.